Hello, my name is Jessica Chappelle and I'm a graduate student at Samford University. Today, I will be demonstrating the Mendelsohn Maneuver that helps with laryngeal/hylolaryngeal elevation. By name and definition, the Mendelsohn is a maneuver indicating to move something or someone in a careful and usually skillful way. It is designed to elevate the larynx and to open the esophagus during a swallow. During the swallow, the individual presses the tongue to the roof of the mouth and squeezes suprahyoid and pharyngeal musculature. This action holds the hylolaryngeal complex in an elevated position for 2 or more seconds. As vagal firing to the upper esophageal sphincter ceases, hylolaryngeal elevation pulls superiorly and anteriorly on the cricoid cartilage, creating a traction force on the cricopharyngeal muscle, the bulk muscle within the upper esophageal sphincter. Pending properly coordinate and sufficient oral and upper pharyngeal swallowing function, this traction pulls the cricopharyngeus and opens the upper esophageal sphincter to allow passage of the bolus into the esophagus. For individuals with reduced hylolaryngeal elevation and residue building in the piriform sinuses, the Mendelsohn Maneuver can improve upper esophageal sphincter opening by increasing hylolaryngeal elevation and consequently upper esophageal sphincter opening. So in the Mendelsohn Maneuver, you want to place 2 fingers on their throat and tell them to swallow. Okay, swallow. Okay, you should feel the larynx elevate and then lower. Then you need to tell them to swallow again, but this time you want them to keep their larynx in the elevated position. Now, to assist in this, you can tell them to press their tongue against the roof of their mouth, and you want them to hold it for 3 seconds. Okay? Swallow. 1, 2, 3. Release. Okay. Then, because the muscles may not have adequate strength at this point in time, they may also hold the larynx during elevation to help them in this exercise. So we're going to swallow 1 more time, and I'm going to hold her larynx in the elevated position. Okay? Swallow. 1, 2, 3. Okay. They need to repeat this exercise 5 to 10 times and throughout the week. Now, I will demonstrate the Mendelsohn Maneuver on myself. First, I will assess my normal swallow. Then, I will swallow without assistance for 3 seconds. And last, I will swallow and assist myself by holding my larynx in the elevated position for 3 seconds. The Mendelsohn Maneuver strengthens the muscles that protect the airway during swallowing. Without airway protection, it can result in choking, excessive coughing, aspiration, and things of that nature. The candidates for treatment need to have adequate language ability to follow directions and must have intact cognitive abilities. They need to be able to understand what they are doing and why they are doing it. They must also be in good physical condition because of the fatigue that comes with these exercises. In a recent study by Gary McCullough and Youngson Kim, 18 participants with dysphagia were evaluated post-stroke with video fluoroscopy after treatment using the Mendelsohn Maneuver and those who did not use the maneuver after treatment. Results showed gains in hyoid movement and upper esophageal sphincter opening, as well as improvements in coordination, timing, and structural movements to aid in the flow of the bolus for the swallowing mechanism. Even though there were not many participants in this particular study, there was still improvement shown using this technique. According to Gary McCullough, this technique has been used since the mid-1980s. He also states that this is a skill technique, but it has proven to be worth it. This is one of the reasons that the patients must have intact cognitive processes for this treatment. It was found that hyalolaryngeal elevation is critical for the successful opening of the upper esophageal sphincter during swallowing. This maneuver provides an immediate impact. Multiple sessions during the week are needed for improvements as well. Neuroimaging also suggests neurologic as well as physical reasons for the success of the patients as well.